Hi friends, hope you're doing well. I'm Dr. Milind. So I welcome you all in another episode of Know the Branch from Specialist. So today we are going to talk about transfusion medicine, one of the less known branch. So we have with us Dr. Sana, who have completed her MD in transfusion medicine from AIMS Bhopal. So let's get to know from more from the branch, more about the branch from her. Hi Sana, we welcome you. Please introduce yourself.
Hi, Milind. I'm Dr. Sana. I was actually doing PG from the same college from where Dr. Milind has also done in pediatrics. So we are old friends.
Yes.
So right now I'm actually working as an SR in AIMS Raipur in the Department of Transfusion Medicine.
Yes, so a lot of students are looking for transfusion medicine as a career, and they want to know about the branch because we get very less in internship. It's elective, branch, so
Yeah.
elective posting. So some students miss out on it. Miss out on it. So tell us first about how did you arrive to the decision that okay you want to pursue career in transfusion medicine?
See, in my case, I preferred a branch with comparatively less workload. So I was going through a lot of branches, what to do. So I was confused like everybody. Then, according to my rank, I saw this branch, transfusion medicine, which I may get in my counseling. Then, what I did is I asked certain people because I myself didn't know what is actually this. So, what people around me said, like faculty, my seniors, everybody just said two, three things. It's a new branch. It has great scope with a lot of opportunities with respect to jobs. So it is just that it is just this what they said. So I also didn't take it too seriously. I didn't do any great study on this. So yeah. So I just took it. Like many have also done the same thing which I have done.
Yes. So we'll now
Yeah.
as you have completed, so we'll try to know more about the branch from you. How was your
Sure. Yeah.
experience in the residency? I mean, how does the transfusion medicine department works?
See, it is mostly blood banking activities on a daily basis. So we have this inventory management, then we have management of donors. We'll collect blood from them. Then we'll have certain procedures done on this collected blood as well. Like we'll separate them into different components. Then we have testing done on this units, for transfusion transmitted infections. Then we'll store them. Then later you cross match and issue for those patients who are in need. So these are the basic activities which will happen on a daily basis. Then there are certain extra procedures that may come, once in a while. Those are apheresis procedures. Like apheresis means, again, whatever you are separating, you're separating the blood into different components. You're doing it by machine. So it is kind of, dialysis kind of thing. So in apheresis, we have plasma exchange, we have for sickle cell anemia, we have red cell exchange. Even in pediatrics, we have this double volume exchange transfusion for neonates with hyperbilirubinemia, all these cases. So these are certain extra procedures. Then there are something else like when you encounter some incompatibility, like blood group incompatibility and certain incompatibility which you will find during cross matching. So there are cases where doctors used to say, we are not getting a proper match, we are not getting a suitable blood for this patient. So solving them. So these are certain rare things that can happen in between, apart from this daily activities.
Okay. So that's something that that new things that we got to know about what happens inside this branch. What about the work timings? Like, how do you what is your work schedule?
See, during residency, of course, like any other branch, it's like full time. But officially, we would say it is 9 to 5. But blood bank runs 24/7. It doesn't have any holiday.
Yes.
Yeah, you should be like you should be with ready with the blood anytime.
Anytime that you need.
Yeah.
That's very
Yeah.
What about like you have already completed? So you told us about your residency. So how does like how was your experience like first, second, and third year? Like how do you differentiate? Like what changes? Like how do you progress in your residency?
See, in my case, I didn't have any seniors in the same branch.
Mm-hmm.
So it was quite difficult for me and my co-PG also to cope up with this new branch.
Mm-hmm.
We knew nothing. And one factor is also very important before taking this branch is to have a background study whether this transfusion medicine people are there in your institute.
Mm-hmm.
Because without any proper guidance, it would be really difficult to go through those 3 years,
Mm-hmm.
which in a way happened negatively to my side. So
Mm-hmm.
that is very important.
Yes. I think lost in a lot of institutes, the transfusion medicine is associated, or I would say headed by pathology department.
Yeah,
So
very true.
so that we should consider that if you want a exposure of proper blood transfusion medicine, look for a college or a place where you get like proper transfusion training. What about like you have already completed your transfusion medicine? So what do you think like about looking for what are the job opportunities that you encountered like after your completion, and what kind of work is there in senior residency?
See, after your residency, there are actually pretty good opportunities because this NMC have actually mandated the inclusion of only transfusion medicine people into this branch. Earlier, it was dominated by pathology pathology medicine people. So there was less opportunities for people who are from transfusion medicine. So in that way, there is a good development in this branch as well. Then coming to the next point, career opportunities, like one, you can go into the academics, you can go as faculty and you can improve like that. Then the other thing is you have this blood transfusion officer post as well. Blood transfusion officer post eligibility is like even to a medicine MBBS graduate who have already completed 1 year of blood banking experience. If that person is having a blood bank experience of 1 year, he's also eligible for
Eligible
this
for the
BTO
training.
post. Yeah, and apart from those people, we transfusion medicine people also.
Yes. So
Yeah, and one
Mhm.
more thing I would say is like if you have a plan to move outside, then it would be quite difficult because it is not that recognized outside India, because they prefer people who have already a good knowledge in hematology as well. So
Acha,
they
okay.
will even see, do you have a hematology degree, like so in that way pathology people will be preferred because
Definitely.
these people can manage both blood bank and their path section as well.
Yes,
So they won't look for a different guy for this. Yeah,
yes,
so in that way.
that's a very good point you pointed out. And I also feel that if someone is looking for something that 9 to 5, and also because I think as it is in a lot of institute, the blood transfusion medicine is there. So if you want to work as a faculty, you can find. I mean, like if you're looking for a job
Yeah,
or
yeah,
work, there is definitely a lot of opportunity to work as a faculty.
yeah,
What are the
because there are many teaching institutes coming up. Everybody are segregating this transfusion medicine branch from pathology,
methodology?
so they do require, yeah,
They,
they
they
do
need more
require
people.
people
They
from this
need
branch.
more people. True.
Yeah, yeah, yeah.
What about like you have been telling? I will ask you what are the being a new branch and being a less spoken branch about what are the challenges or cons that you have faced like that you want to talk about the branch, like what difficulties a new joinee faces like when you join this
Yeah.
branch.
To be honest, I would say some things which I'm actually seeing around, and it also happened with me as well. Many new people who didn't know what is this branch, they take up this branch, they land up in this branch, and finally they feel quite demotivated, dissatisfied because of again the poor guidance. Because you don't have transfusion medicine faculty in every institute, so that is one thing you have to check before you take it. Then next thing is, this blood banking activities, as I said, it is mostly an administrator kind of job. So those people who really love patient interaction, they will miss out on that, and they'll end up again
Yes.
dissatisfied at the end of the day. So that is some negative side, which I would say. But there are people who are really comfortable with this 9 to 5, and they're happy.
Yes.
Yeah.
Yes. I think that's a very good point that you brought out. Lastly, I have a very interesting question from one of the aspirant. I mean, some students who are preparing and who are not happy with their rank, sometimes they take up transfusion medicine because they want to prepare simultaneously. So, as per your experience, like, is it possible? Do you get time? I mean, I don't know. I will not.
Mm,
I'm not saying whether it's right or wrong. But if someone whose family situation or financial things or any
I
uncertainty,
understand. Yeah.
they require him or her to pursue certain job. So, like, is transfusion medicine something that the person can do and prepare simultaneously?
Uh, in a way, I would say yes, because you don't have much job where your requirement is there throughout the, office time, throughout the whole time, because you are assisted by a lot of technicians. So you just have to, cross check, verify things, so there is time, but still, again, if the institute, you have to, it depends on the institute.
Yes,
Some people can be really,
I know.
uh,
Yes,
strict about all
yeah,
those things,
yes,
because you're a resident and they won't tolerate all this kind of thing. Some people are really cool with that as well. So again, you have to check on that thing as well.
but
Yeah.
can I
But
say?
in, I would say, you would get time. You just have to manage, things really well, and you can extract time out of it. It is possible. Yeah.
Can I say, like, you will be less fatigued as compared to other branches? Like, when once you come back at maybe at 5, you might be less fatigued as compared to, like, if you want to take some
Yeah,
hectic
yeah,
branch.
yeah, yeah.
So you can come again
You're
at 5.
not running throughout the ward and
Mhm.
hospital and behind the patient. So you are okay. You can even carry on with your studies after 5. That's cool.
That's
Yeah.
good. So I
Mm.
think yes. So you have given us literally, glimpse and all the sites and spectrum on all the points about the branch. You have explained very well. So thank you so much, Sana, for taking out time, because a lot of students were consistently asking, because
Thank you so much, because I would say, yeah,
a lot of students, they don't know about the branch, so they are always looking for someone who will
yeah,
honestly,
yeah, yeah.
honestly give a review and answer these
Mm.
kind of questions which are always there. So thank you so much for
Yeah, yeah.
clearing all this.
Even I'm also pleased to, to get this opportunity, so that, I don't want to mislead anyone. The truth is truth,
Yes,
so
thank you.
this is necessary, actually.
Yes.
Yeah.
Thank you so much, Sana, and I'm sure this video is
Yeah.
going to
Thank you so
answer a
much.
lot of
Yeah.
questions. Thank you.
Okay. Thank you. Bye.